Okay, everybody, so today we're going to do a demonstration for DNTL 169, Learning Outcomes 8 and 9. So I'll be the operator in this situation, and Stacy's going to be my fabulous assistant. So first thing you're going to do is you're going to get your chart. You're going to come in and review that at the desk here at the tablet, okay? So what she's going to do is she's going to open up the chart. She's going to confirm the date on the x-rays is within the last year, which it is. Do a quick review of the health history forms, which are all laid out for you. And then what we're going to do is we're going to go onto our tablet. Just for the sake of time here, I have booked the appointment for our client, Martha. So Stacy's going to go in and take a look at that appointment, and we'll determine what treatment we need to be making today.
Looks like we're going to be doing the 1,6-MO, an amalgam, and the 1,2 distal lingual is going to be a composite.
Okay, so once she's determined that, what we're going to do is we're going to go into questionnaires. So questionnaires is one of the features of Dentrix, and we're going to go into the restorative care plan. So what we're going to make sure we check here is that we've reviewed the health history, we've reviewed the chart, and we know what treatment needs to be done. So Stacey's just going to enter here what we're going to do today for our client. So it's a 1,6-MO amalgam and a 1,2 distal lingual composite. Okay, and then we are going to make note that we reviewed the health history. We have to enter the date of the last x-ray so that we know when those were taken. So it brings up a calendar. Stacey will just enter those dates in for us. This is all practice to prepare you for getting into clinic. So then we're going to go through our plan. So our anesthetic that we're going to use is our benzocaine for today for our topical. And we're also going to use moisture control. We're going to use a dental dam. For composite materials, we'll use our composite, burrs, sandpaper strips, flowable curing lights, and a bonding system. For amalgam, we are going to use amalgam, our bonding system, a curing light, and burrs. You can skip the surgical extraction. We're not going to do that. For matrices, we're going to use our Toffelmeyer system, as well as a plastic strip and wedges. We are not doing any sealants today. So you'll come at this point and get your instructor. They will review it with you, and they will initial your restorative care plan. For the purposes of today, we don't actually want to save these care plans. So what we're going to do is, once we've reviewed it, we're just going to hit cancel. And that will take us out of that screen. Okay, so once we have done that, we have touched our chart, we've touched the tablet, so the next thing we need to do is hand hygiene. So for this instance, Stacy and I are both going to do a subsequent hand gel, and then we're going to go and visit our client who's been seated in the chair and talk about the treatment plan. Okay. So Martha has been seated in our chair for us. So what Stacy's going to do first is confirm her setup here, okay?
Yeah, so I've done my setup. We have pictures of this that will be at every operatory. So I've set up my dental dam. I have some burrs out. I have set up my hand pieces. I've checked my water and my syringe tips for 5 seconds, like you've all been taught to do. Over here I have my restorative tray set up. I have my banding system, my bonding system, and then my composite and amalgam, which I will use for the fillings, okay? I kind of like to go from left to right, band, bond, fill, all right? Keep things organized for yourself. I also have my curing light out. I'm gonna make sure I turn on my amalgamator. All right. One thing that I'm going to do before we start is ask my operator, what burrs would you like in your hand pieces, Amanda?
I would like a 330 burr, please.
Okay.
And a round low speed burr.
Okay.
Latch burr. So Stacy's going to remove those with the marked cotton pliers that are on the tray troll and place them into our hand pieces.
So with the high speed, there's just a little button on the back. You're going to press that. As you're pressing it, you're going to put the burr in, and then release the button on the back, okay? Give it a good tug to make sure that's in there correctly. With the low speed, there's also a button on the back. It has a latch though. If you take a look here, that burr has a little bit of a latch. So you're just gonna press that back button, insert the burr, and sometimes you have to give it a little bit of a twist and then let go. Give it a good tug to ensure that that is in there as well. All right, so I have my burrs in my hand pieces. When you go to run your hand pieces to make sure that they are operating correctly, make sure that you have the toggle turned on the rheostat, okay? So you see there's a little blue dot there. Make sure you just kick that little toggle over towards that blue dot to ensure that we are able to run water through our hand pieces. So what I'm gonna do first is run my low speed. Typically it will be set at 0. So I have a reverse, neutral, and then a forward button. I'm just gonna turn this towards forward, and then I'm gonna give it a little bit of a run. Okay, it's running properly, so when my operator picks it up, it will be working. I'm gonna place it so that the burr is facing towards the tray troll, okay? Next is my high-speed handpiece, and high-speed handpieces are run with water, so that's why I needed to make sure that toggle was turned on properly. I'm just gonna run this and make sure that the water is coming out. I can see that it is. So again with this, I'm gonna make sure it's pointing towards the tray troll. Okay, so I have my burrs in my hand pieces. One other thing that I want to ask Amanda is, what color of composite cartridges should I put out?
So for today's procedure, I will take an A2 cartridge, please.
Okay.
And that is what Stacy's going to do. Is she's gonna go into her tub here and retrieve with her marked pliers some of our composite. For the purposes of this course, there is just an assortment of cartridges in there, so you don't actually need to be specific for which one you are retrieving.
Okay, so I've done my setup. I've asked the operator what burrs she would like in her hand pieces, and I've asked her what shades of composite she would like out. So that's all complete, my setup is done. Now what I'm going to do is retrieve my patient, okay? So I have the patient in the chair. I'm going to ensure that safety glasses are on the patient, and I've put a bib on them as well. Now what I'm gonna do are my pre-operative instructions, okay? So I'm gonna make sure I come around and talk directly to the patient. I don't wanna be standing behind him or her, okay? What's my patient's name again?
Martha.
Martha. Martha, hello. My name is Stacy. I'm going to be your dental assistant for today. Today we are going to be working on 2 teeth on the upper right. The tooth on the back right is going to be a silver filling, and then the tooth on the front is going to be a tooth colored filling. Today we will be using anesthetic or dental freezing. Have you ever had that before? No? Okay, well we just use it to make your appointment a lot more comfortable. We're also going to be using a dental dam today, and that's just to make sure that you don't have to swallow a lot of water. Do you have any questions today, Martha? Are you okay for us to proceed? Yes? Perfect. I'm just going to wash my hands and get gowned up, and we will start shortly. So now what I would do is I'm going to do a subsequent wash at the sink. Make sure you do your full 20-second wash. I might have cut that short a bit there. And then I'm going to proceed to the donning area. So I'm already wearing a level 3 mask, and I have my bonnet on. So as per the instructions, I think what I can do, I've already washed my hands, so I can dive into a gown right now. These gowns, you'll get used to putting them on, but some of them have ties that are in different spaces than the other ones.
For the purposes of this course, we will not have you full gowning for the beginning. We will start gowning closer towards the end for practice purposes. We're just trying to save gowns, but right now we will do it just for the sake of our video because we will be doing this during the procedure.
Because I've just touched the back of my neck, I'm going to do a gel. And next what I would do is I would put on my shield. Okay, next what I would do is another subsequent hand hygiene and then put my gloves on, and then I would go and sit at my unit. Because this echoes so badly for the purpose of the video, I'm not going to wear it. So what I'll do is I'll just do a gel. I'll head back to the unit, get my gloves on, and we're ready to start.
With this procedure, we will be wearing our shields more for the fact of getting you guys used to using them, and you will be using them for restorative procedures. So we'll have them out for you when you come in for clinic that day. So we will proceed back to our unit, and Stacey and I are both going to get our gloves on. Hi Martha, how are you? Are you excited for our treatment today? We are. So, your operator will tip your patient back or your client back for you. You can bring the light down. Okay, so I know Stacey went over the pre-op instructions with you for today. Do you have any questions at all before we begin? No? All right. So the first thing I'm going to do as the operator is I'm going to take my dental dam armamentarium and put it over on the assisted side here.
This will give you time to practice doing four-handed dentistry with putting dental dam on. Thank you.
Okay, so the first thing that your operator is going to do is they are going to request their mirror and explorer so they can check where the fillings are going to be done. Okay, so today we are working on this anterior tooth here, number 1, 2, as well as number 1, 6. Okay, perfect. Those cavities are still there, so we're ready to proceed. So Stacey is going to two-hand pass the topical anesthetic. I will dry and place our topical anesthetic.
And what can I assemble for you, Amanda?
I would like a blue tip, Stacey, and an ultracane, please.
Okay, so with my marked cotton tip pliers, I am going to go in and grab a blue tip. I'm going to make sure I don't touch the inside of the drawer with my gloves, and I will grab the anesthetic and put my marked cotton pliers back out there. I'm going to ensure that the correct date is within the expiry date. Awesome. And so now I'm going to assemble my syringe. So what I'm going to do is click my needle first. I'm going to make sure I have this out so that I can recap it. And with a fulcrum, I'm going to put my needle in. Okay, make sure that you're being safe and you're using a fulcrum. Okay. Now I'm going to safely check this and make sure that it's working. I don't want to touch my gauze with the end of the needle. And again, my lid is out so that I can recap it. When I recap it, I'm going to be very careful not to touch the counter with the needle. I'm going to recap it very carefully and make sure that this ring is on there tight so that when Amanda picks it up, it doesn't fall off. I'll then point it towards her, the ring, so that she can access it safely.
Thank you, Stacey. So the one thing that we're going to make sure you do is verbalize that expiry date for your operator. It's part of your safety requirements, so we're ensured that you've checked that, okay? So your operator will then just take your topical anesthetic and discard it.
And I'm going to take my arms and cover the patient with them. I don't have to touch the patient, but I'm just going to guard them so that if they jump or put their arms up, Amanda is safe and she doesn't get hit.
Okay, so your operator will take the syringe from the back of the counter and come around here. I will retract with my mirror and do my injections here. It's a very important safety note that Stacy has there, is making sure that we are protecting the client as well as the operators, okay? Okay, so the anesthetic is now complete. I will come back around the back of the counter.
The first thing I'm going to do is give the patient a rinse because, as we all know, anesthetic tastes horrible. I don't have water in mine. Perfect.
Okay, so our anesthetic has now been completed. The next thing that Stacy is going to do
Is pass the shade guide. I've turned the light away because picking a shade is better when the light isn't directly on the tube.
So we need to pick a shade because it's an anterior composite and we want to make sure it blends properly with the tooth structure, okay? So Stacy, I will take that A2.
Okay,
That's
sounds
perfect.
good.
Thank you.
I'll
So
take
you
that
can
back.
take that back. Perfect.
And I'll turn the light back up for you, Amanda,
Thank
so that you
you.
can see. I'm just going to test this composite cartridge now. So I'll just place it in my little composite carrier, take the lid off. I'm just going to disperse a little bit on some gauze to make sure that it's working and it's good. And we're good. I'll set this down here for later when we go to fill that filling. While Amanda is punching her dental down, I'm going to put some floss on the clamp like you learned in DNTL 168.
Safety floss is very important. And we must have it on anytime a clamp is placed into the mouth.
So I know the first thing that Amanda's going to do is put her clamp on the tooth. So I'm going to have my forceps ready and the clamp, and of course, because we're working on the upper, she will need her mirror. So I'm going to give her that.
Thank you.
Then what I'm going to do is I'm going to pass the forceps, and I think she'll just grab that clamp like that and put it on the forceps herself.
Ensuring that we're in the transfer zone while we're doing this, okay? I have the clamp placed in the forceps with my floss around my finger. I'm going to come in with my mirror and place my clamp. Okay. Stacy will take the forceps. I'm going to ensure my clamp is stable. Then I'm going to set my mirror down, bring in my dental dam.
I'm going to take my unmarked dental pliers and reach in through so that I can grab the floss. I'm always a little awkward when I do this, but we somehow get it figured out. Make sure that you use your unmarked pliers that are intraoral to do that.
And your operator will make sure she's got it in the right orientation when she goes to do that.
Let's try that again.
That one was smoother.
The end result is that we're going to have a dental dam on Martha sometime today.
We all need practice.
Yep.
All right, so I'm just going to slide it around the clamp here.
And then we can kind of do this together.
Yeah, it's a four-handed dam placement is what we're working on here.
Amanda will do that side, I'll do the left side.
Making sure that our safety floss is around our frame.
And Amanda, your floss is just over on your tray. Want me to hold it?
So your operator will just floss the dam down. This is not dental dam class, this is restorative class, so if the dam is not perfect, we are just trying to get it on to get you through to the next portion of this class. ready to invert the dam, please.
So I'm gonna pass Amanda the mirror and a PFI. There you go.
Your operator will invert the dam.
And once she's done that, I'm just gonna take the PFI back because she'll keep her mirror as she will need it to do her high speed and her low speed.
So for the purpose of today, what we'll do is we'll end up just cutting a section of the dental dam as our ligature. So Stacy's just gonna pass me the scissors. I will cut a small section of the dam. Pass the scissors back to Stacy and place my ligature. Okay, and we are ready to proceed with preparing the filling. So your operator will start with the high-speed hand piece, okay? So with the high speed, we're going to start on the anterior preparation. You will place your suction, and your operator will proceed to prep your preparation. Now, the important part here is that you are using air on your operator's mirror to make sure it is clear, and that you are not blocking their view with your air water syringe tip. Okay? All right, so you'll rinse and dry the preparation whenever your operator removes the hand pieces. They will then, I'm going to request an explorer, please. Through the transfer zone. Thank you, Stacy. Good. Okay, and we will continue on. This time I'm going to go in with my low speed hand piece. So Stacy's going to again place her suction. With the low speed, you want to come in and blow intermittent puffs of air into the preparation. Okay, what Stacy's doing. Again, careful not to block the mirror. Okay, and we will rinse and dry again as we have taken the hand pieces out. Okay, and I'll take my explorer again, please. Thank you, Stacy. Okay, so that preparation has been completed. We'll move on to the posterior. Okay, so high-speed hand piece again. You're going to come in, place your suction, and ensuring that there's no water on the mirror for the operator. Okay. Rinse and dry. I will take my explorer, please. Thank you. Okay. I'm going to move on to my low speed again here, Stacy, please. Thank you. Again, blowing into the preparation. Occasionally, you may need to check your operator's mirror if you see there's debris coming onto their mirror. Okay, and you can wash and dry, please. I will take my explorer. Thank you. Okay, so I would like my spoon excavator, please, Stacy. So we're going to do our transfer. As I'm using a cutting instrument, Stacy's going to have the gauze ready to wipe off for me. Okay, I'm complete with that. Everything looks good, so we are going to begin restoring with the anterior tooth, please, Stacy.
Okay. So the first thing I'll do is I'll pass her my plastic strip. Okay. And then with a plastic strip, she will need a wedge. I'm gonna just ask, what color wedge would you like?
I'll take the blue one, please, Stacy.
Blue one? Okay.
Yes.
So I'm gonna put that wedge in my hand like so, pass her the intraoral cotton pliers, and she'll just take it from my hand.
And I will orientate it how I need to. I'm just gonna pass Stacy back my mirror here so I have an extra hand. maybe the orange. Yes, please, Stacy. Thank you. Thought I could get the blue guy in there. Sometimes these anterior guys like to fight us. There we go. Okay. I'll take that back. Thank you.
So what I'll do next is I'll give the prep a good wash, because with Amanda putting that wedge in, there could be a little bit of blood there, and we don't want to put a filling on a tooth that needs to be washed. So she'll hold that strip,
And I'll guide her in if needed.
and now the tooth is washed and dried.
If we don't hold that strip in, sometimes it blows away.
Yes.
So we want to make sure we hold it in place.
So now we're going to start the bonding sequence. So our bond just has a little thing where you have to press to activate it, okay? Then what you can do, sometimes your microtip brush will fit in. I'm just gonna put it like this. I'm gonna give my brush a little bit of a bend so it's better for Amanda to apply it. And then with this, it has to be applied for 20 seconds. So my job is to ask Amanda, can I watch the clock for you for 20 seconds?
Yes, please.
Okay.
There is a card that will be available to you throughout this course that will be laminated, and it's on the back counter there. So with this entire bonding sequence, okay? So if you ever have any questions, you can refer to that at any time.
Yep. So 20 seconds is up, Amanda.
Thank you.
Now the bonding sequence requires that I air dry that for 5 seconds. So I'm gonna grab my air, and I'm just gonna give it a couple little puffs so that I ensure I don't put any water into the prep. I'm gonna come in here with my air, and Amanda is going to guide me. And for 5 seconds, I'm just gonna blow a light stream of air. So 1, 2, 3, 4, and 5. Good. And then what I need to do is cure for 10 seconds. So I have my light here. I'm gonna bring my paddle over. Again, Amanda is going to ensure that she's guiding me in. I have it set for 10 seconds.
So we'll turn the tip up here and I will help guide. And Stacy is going to use the paddle to protect us both so that our eyes are shielded from the curing light. Okay, 10 seconds has passed.
All right, so the first material I'm gonna pass Amanda is the
Flowable
composite.
Okay, so a lot of operators will use a flowable composite as a liner essentially on their anterior teeth or on their composites. So your operator will place the flowable into the preparation. You'll pass it back, and you'll then use an explorer to move the flowable around, having a gauze ready to wipe that off of the instrument as needed. Okay, thank you, Stacy, and we can cure that, please. The flowable composite is cured for 20 seconds.
So I will have to make sure I change my setting to 20. Amanda's gonna help me again. I'm gonna protect both of us, and we will cure for 20 seconds.
So that has been cured. The next step that we're going to do is place the composite. So Stacy's going to pass me the composite dispenser in my palm like she just did there. I will take and squeeze it into my preparation.
The first instrument I'm going to pass her is a composite packing instrument. So you can see this end where it's a little condenser, but it's the composite packing instrument. I'm going to pass that to her first.
Okay, and I'm going to pack my composite. The next instrument I'm going to take is a PFI, or flat plastic. As you can see, it's a paddle, okay? Stacy has passed the Teflon instruments. Some cassettes have a gold, some have Teflon. The important part is knowing that you just can't use the stainless steel instruments while using composite. Okay, thank you, Stacy.
You are welcome.
So we are ready to cure the composite. So the operator will hold the mylar strip and help guide you into your or your filling here.
And this again is 20 seconds. This is what I call my time to rest during the procedure.
Rest and regroup.
Yes. Thinking what comes next. And what's going to come next is Amanda is going to remove her plastic matrix. So I already know in my mind what I want to pass her. I'm going to pass her the intraoral.
I'm going to remove the strip.
Okay, I'll take that.
That, and then I will have my pliers, my intraoral pliers. I will remove my wedge. Palm it to Stacy so she doesn't lose it there. And Stacy's going to take it and put that in her kidney basin so we don't lose it. Okay, so the next thing that we're going to do, the filling has been completed. I'm going to smooth the lingual of the restoration. So your operator will go into their burrs and take out a polishing high-speed burr. They're going to get another one when they drop the first one. They come with a plastic coating on them. I'll take out this 330 burr. I will leave it on the tray. Place my polishing burr. Okay. Take my mirror back. And we're going to smooth the lingual of the restoration. So again, you're going to come in for the suction there. Stacey's going to come in and get ready to blow puffs of air onto the mirror to ensure that I have vision. So the next thing I'm going to do is request an explorer to check the lingual of that. Make sure it's nice and smooth. Thanks, Stacy. Oh, that's beautifully smooth. Oh, the next thing that we're going to do is check the interproximal, please. So we're going to do a two-handed transfer. Stacy's going to take the mirror and explorer and flip me the floss. Okay. Oh, it's a little rough, Stacy.
Is it? Okay, I will give you a sandpaper strip then.
So again, two-handed floss for the sandpaper strip. Then Stacy's gonna flip her floss around and get ready to transfer it again. Take the strip and give me the floss.
And how's that?
That is perfect. Excellent. Okay, we are ready to restore the posterior.
All right, so I have my Toffelmeyer already set up. I set it up at the beginning when I knew that we were doing a 1/6. So I have it set up to the upper right, and I'm going to pass that to Amanda right away.
Perfect. And I will take my mirror as well, please, Stacy, so I can see. Thank you.
Your operator might put his or her mirror down on the tray troll or behind them. Don't worry about that. If they have to ask for it, it's not a big deal.
Not at all. I have a tendency of putting it anywhere, and any operator you ever work with, it goes wherever they choose.
Amanda has put on her band. Now what we're gonna do is start the Toffelmeyer sequencing. So we're gonna start with the Explorer.
You.
And then of course we place a wedge. What wedge would you like?
I'll take the orange wedge.
Orange wedge? Okay.
I'm going to take the Explorer. I'll take my cotton plier and my wedge. Properly here. Then I will pass Stacy the cotton plier. She will pass me the Explorer next, followed by
the burnisher.
The burnisher. Notice how Stacy's not shorting me any instruments. Everything has been passed exactly where it needs to be.
Thank you.
Okay. All right. So we are ready to begin our bonding sequence.
Okay, I'm going to just wash that prep first.
The purpose for washing and drying is making sure that we have any possible debris out of that preparation and then it's clean before we go ahead and proceed with our bond. So Stacey has rinsed and dried.
All right, so can I watch the clock for 20 seconds, Amanda?
Yes, please. Thank you. So she passed me the brush there. Your operator may come back and dip in here. That is fine. Most do. And they're going to agitate for the 20 seconds. As you can see, Stacy is watching her clock.
And that is 20 seconds. Thank you.
Thank you.
Now I'm going to air dry for 5 seconds. Again, I'm going to give my air water syringe a couple little puffs with that air so I know it's air that's coming out. Amanda will guide me in. And we're going to go 1, 2, 3, 4, and 5. And then a for 10 seconds. So I will have to reset this. Thank you.
I will guide her light in to ensure that we are in the correct place.
And we're going to cure for 10.
And sometimes your operator may help secure this for you if we don't want it resting on their face.
Right.
Okay.
Awesome.
All right, so I am ready for some amalgam.
Hey, would you like a single spill or a double spill?
We'll go with a single spill today,
Okay. So some of these spills are a little bit different. This single spill, you just have to kind of click it in like so. And then what I'm going to do is just open my amalgamator, insert the cartridge, close the lid. It's set for 10 seconds.
Sometimes they are a struggle to get out of the amalgamator.
Then you just have to open it like so and dump it into this little well. Then I have my amalgam carrier. I'm just going to squish it down into that amalgam. I think Shannon Cowan would have taught you this. And I'm going to pass it to Amanda.
So the transfer for this is she's going to transfer it into my hand like this, okay? So that I can hold this carrier correctly.
And the first instrument I'm going to pass her will be a condenser, and this can be a stainless steel instrument. There you go.
Thank
And
you.
would you like another carry?
I would love another one, please. Thank you.
So I'm going to come back, get a little bit more amalgam. Typically, there will be at least 2 carries that are needed of amalgam. Come back in.
Now, Stacy, I'll take the same end of that condenser,
Okay.
please.
So same end, I'm going to come over to my rotating countertop and make sure that I do that same end or opposite end over top of my cassette. I don't want to do it over top of my lap. That's very dangerous. So I've changed it to the same end. I'm going to come back into the transfer zone and give Amanda her same end. Would you like any more?
That'll be okay, thank you.
Okay. So what I'm going to do next is go right to my next instrument in my sequencing, and that will be my ball burnisher. So I'm going to come in there. Amanda's going to smooth out that amalgam. What will be next in the sequencing is an explorer.
And the explorer is used to remove any excess material from the band so that it's easier to remove.
And what carver would you like, Amanda?
I would take the disc end of the discoid cleoid, please.
So here's our disc end. It's just a little round one. I'm going to pass that to Amanda. She's going to do some carving. She's going to put some anatomy into her filling.
Okay, and I will take the Holland back instrument, please, Stacey. Thank you. All right, and I will take the opposite end of that as well.
Again, I'm going to flip this over top of my cassette and then come back into the transfer zone.
Okay, I'm going to remove my Talfmeyer now. All right, so I will do the outer knob first. Get that to Stacy, and then I'm going to remove my matrix band. Careful to remove the mesials first or last, as that is my preparation.
I'm going to come in with the intraoral pliers, and Amanda will remove her wedge.
I'm going to palm it to Stacy so she has that. Okay, so the next thing I'm going to do is just take another carver, please, Stacy. So
Okay.
I'll take my
What carver would you like?
disc end of my discoid cleoid. Okay, please. Thank you. Okay, so we are going to check the interproximal on that.
So I'm going to pass her my unwaxed floss again.
Good. Oh, and that's wonderfully
Is
smooth,
it
Stacy.
good?
Thank you.
Awesome. I'll take that back. Here's your mirror.
Okay, and we are ready to remove the dental dam.
Okay, so before we remove the dam, we have to see that there's a ton of amalgam bits in there. If we took this dam off without removing those first, it could be very dangerous for the client, as they might swallow those silver bits of filling material. So the first thing I'm going to do when Amanda tells me it's time to take off the dental dam is I'm going to suction up all those little bits. Now, if there's some that are kind of sticking there and aren't going up my suction, I'm going to use my water only, no air, to remove them. So no air, you don't want
do is take out their floss or their ligature. I'll pass that to Stacy. I'm going to take my scissors and I'm going to cut my septa. Pass the scissors back, and Stacy's got my forceps and my mirror. And what I'm going to do is I'm going to take the whole unit off, come around to my side, and Stacy's going to give the client a full mouth rinse. While Stacy's doing her full mouth rinse, your operator will take a look at the dental dam and ensure that it is intact, okay? Okay, perfect, Stacy. So that looks great. I'm going to take a look here. Now what we're going to do is we're going to adjust or check the bite, okay? So we'll start with the anterior, or the posterior tooth.
Okay, I'm just gonna dry that.
So Stacy's using her air water syringe. You could use gauze, but you have the air water in your hand anyway, so you're gonna use that. I'm going to take my articulating paper, check my bite on that filling. Oh, it is high, Stacy. I would like to adjust it, please.
What carver would you like?
I'll take my cleoid end of my discoid cleoid, please.
Okay.
So Stacy's going to take the articulating paper, pass me my carver, and right away, she is going to go in and get her high volume suction, okay? This is very important to Stacy, as you don't want the little bits of amalgam to be falling into the client's throat, okay? What your operator may do is take these little bits that are on the instrument and push them into your suction. That is okay. Some do, some don't. Okay, Stacey, I'm ready to check that bite again, please. Okay, so as that tooth has already been dried, we haven't contaminated it again, so we don't need to dry again. Check the occlusion here.
How does that look, Amanda?
Oh, that looks much better, Stacy. I'll check the anterior now,
Okay.
please.
I'm just gonna dry that for you.
Thank you. And again, I'm gonna come in and chomp, chomp, chomp. Pass that to Stacy. Oh, that is high as well. So first thing I'm going to use is my high-speed handpiece with my polishing burr again. So Stacy's going to come in and place her suction. Dry again. We'll check that bite again. Thank you. I'll pass that back. Well, that looks better, Stacy, but I think I'm just going to polish that with one more polisher really quickly to make sure it's nice and smooth. Okay. So your operator is going to come over to their burr block again, and they're going to get a polishing disc out, or a point, whichever they happen to choose. This is going to go into your latch handpiece. Okay, your slow speed, and they latch themselves into place. Okay. So for this, Stacy's going to bring her suction and everything in again as well. She's likely still going to blow the air onto the tech because there's going to be debris that comes off of these little discs potentially, so it's nice to keep it clean. Okay, that looks much better. Thank you, Stacy.
I'm going to give it a good rinse because that's going to be a little bit gritty afterwards.
Okay, so this is one of those situations your operator is likely just going to take their mirror and put it down. Okay, so our procedure is complete. So what we're going to do next is we're going to seat up our client. So your operator will likely be the one adjusting the chair. The assistant will have to get up and ensure that the light is out of the way of the client so they don't get their head hit on it when they come up, okay? So the first thing we're going to ensure that we do is our wellness check, okay?
Martha, how are you feeling? You've been laying back for quite some time now. Is everything okay? Yes? Okay. So I just have a few things to go over with you before you leave. You've had 2 fillings again today on the top right. The one at the back is not fully set. It takes 24 hours to set, so be careful not to chew on that side for the next day. The one at the front is fully hardened, so you can chew on it right away, okay? You have had freezing, so take care not to bite your lip or your cheek, okay? And if your freezing comes out and the bite seems high or off, please make sure you contact our office so that we can take a look at it and possibly adjust it. Also, sensitivity to hot and cold is normal, but if those symptoms persist or worsen, please call our office and we'll get you in to check. Have a great day.
Okay, so that is the completion of the procedure for DNTL 169, LOs 8 and 9. You'll have lots of practice on this, so we will take advantage of every lab that we get. If you have any questions, there is going to be a procedural outline available to you for every lab, and take advantage of your time. Thank you.
All right, so Martha is gone. As you can see, I've made a complete mess of my rotating card surface. That happens a lot, but now it's time to tidy up. One of the things that you're gonna have to do is make sure that you get your sharps and your biohazards to the correct area when you're done, okay? So what I'm gonna do first is get rid of my amalgam pieces. I still have some left over. I can't throw those in the garbage. So we have a scrap amalgam container that those will go in until they're discarded properly. So I literally just dump that in like so. Put the cap back on and get that out of my way. Another thing that I have to do is remove any tips that were on my cartridges or composite. One of them is this, my flow bowl. I simply untwist it, put it in my kidney basin, and then I'm going to replace the lid back on it so that the rest of the material doesn't dry out. Okay? Any wedges that I might have used, I'm gonna throw in here. Okay, so you can see that orange wedge. I'll just throw that blue one in there as well. My bonding system will go in there. Okay, any composite that I didn't use will go in there as well. Okay, and the rest can just all go in the garbage, so I'm not worried about that. What I'm gonna do now is make sure that I disassemble my syringe correctly. Okay, so first thing you do is pull back on your syringe, take your cartridge out, and that will go in your kidney basin. Then what you're gonna do is remove the needle, okay? Make sure you have a fulcrum when you do that. You wanna make sure you're safe when you're disassembling it, just like you were safe when you assembled it. Okay, gonna line up my cap. Make sure my hand isn't in front of there. Slide that in, put the cap back on, put it in my kidney basin. Okay, one thing I forgot to put in there was just my applicator. Okay, that has chemical on it, so it will have to go into that kidney basin as well. Lastly, I'm going to come over to my hand pieces. My amalgam capsule will go in there as well. And remove the burrs. Okay, so Amanda has 2 burrs out. I'm going to safely put them in here. And then I'm going to remove the burrs in the hand pieces. So like I put these burrs in, I'm simply going to press on this button at the back, carefully grasp the burr and pull out, okay? Again with the slow speed, press that back button, pull out, and this will go in the kidney basin as well, okay? I have a little bit of composite on this gauze that when I tested it, it hasn't been cured, so it will go in here as well. Now what I'm gonna do is pick up my kidney basin. I'm not gonna put my fingers in there. That's dangerous because there's sharps in there. I'm gonna pick it up like so and hold it like this. And I'm gonna head to the Steri Center where we have our chemical hazardous waste and our sharps waste that I will put these in. Okay, so there will be cotton pliers available for you. On the left, we have our sharps. On the right, we have our chemical waste. Okay, so what I'm gonna do first is I'm gonna just get rid of some of the bigger pieces. This piece with the composite will go into the chemical waste. My little composite applicator will go in there. My bond will go in there. My composite. We will have a separate container for our amalgam. And that's just gonna be over here. Boom. Okay. Some of the stuff that I put in here doesn't really have to go in any of these specific areas, so I could just put them in the garbage. My little piece of dental dam. This plastic matrix, I'll just throw that in my chemical as well, because composite would have been on there. And then I think the rest will just go right into my sharps. So I have my wedges, my band, my needle, and my cartridge. My tip and my burrs will go in sharps. This I'm going to put in, I think I'm just going to throw that in the chemical. Now the rest, so that I don't have to touch them, I'm just literally going to take my kidney basin and dump it. Okay, I'm going to make sure that everything's out of there. And now I'm going to head back to my unit and start cleaning and disinfecting.